Hello, welcome back, and good morning or good afternoon, wherever you are. My name is Carlos Crespo, and I'm a professor in the Oregon Health Science University and Portland State University School of Public Health. I'm also Vice Provost for undergraduate training in biomedical research at Portland State University. I serve as a member of this workshop's planning committee, and during the next session, very exciting sessions, we'll be hearing from two speakers. And then we're going to follow that with discussions and for questions and answers with the audience. If you have a question, please type it in your chat box. And if you are able to let us know which speaker you are directing the question to, that would be great. I will share with them, with the speakers during the questions and answer portion near the end of this session. So we'll have that section at the end. The full bios of all the speakers are included in the meeting materials on the webpage for this event. So I'm not going to go in a lot of details on their bio sketch. But both speakers are highly accomplished. They're expert in their field and highly regarded by their contribution to the field of stigma, discrimination, and obesity research. We are really delighted to have such accomplished speakers. But before we start, I want to share some thoughts to introduce the session. We rely on mental models to get things done. And mental models then become, it's like a behavioral reflex. It's a shortcut. It's like an algorithm, which is something we're familiar with when we talk about models and mental models. And these models, these algorithms are as good as the assumptions that we make. Therefore, it is important that we learn how to deconstruct these assumptions and these biases, because they actually become a way of how we react, even subconsciously. One of the assumptions that we do with weight bias is that they happen at the individual level, but they also exist at the institutional and structural level. And these weight bias become these negative attitudes that are based on distorted beliefs. And these are the same attitudes and beliefs that provide the foundation for how we create organizational norms. And ultimately, these organizational norms create the stereotypes that negatively impact the lives of people who live with obesity. So what we're going to learn in the next couple of sessions is that these attitudes that permeate multiple spaces, and they have reached a level of normalcy that are actually sick in an irresponsible way, especially when we're dealing with healthcare industry, with workplaces. We have normalized it. And therefore, we just need to deconstruct, eliminate that, not just at the individual level, but then at an institutional level. And the narrative, therefore, has to be rewritten in every space. We learn about housing, we learn about education, but this narrative has to be also rewritten in the workplace and the healthcare, among many other spaces. And today, we have picked a couple of those spaces. They have the opportunity to be generalized into other spaces. The stigma that comes with obesity, as you have heard from earlier speakers, has caused exclusion, have marginalized populations, has created discrimination, and all these things end up ultimately causing a very serious health inequities. And one of the challenges that we face here is that these health inequities are ending up hurting the very same people who are now at higher risk for other chronic diseases, for mental health challenges. And now, where we are in the middle of this pandemic, we have learned that it actually exacerbates the impact of communicable diseases like COVID-19. So let's use that as a background for me to introduce you our next speakers.